If you want to get involved in advocacy, we need to have that dialogue to find out how much time, how much energy do you want to be putting into this advocacy role. We are certainly open to anyone who, member or non-member, who wants to have that dialogue about nursing advocacy. We are the ones that really go out and advocate for all nurses, but certainly we advocate for whether you are a member or you're not a member.
Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession.
Today, we have Judy Schmidt, the CEO of the New Jersey State Nurses Association and Institute for Nursing. This is not Judy's first time on the podcast. We are so happy to have you back, Judy. Thank you for joining us.
Thank you, Stephanie.
So, Judy, so glad to have you on as we talk today about nurse advocacy and New Jersey state nursing legislation. You have been our fearless leader and the CEO of the New Jersey State Nursing Association for about 9 years now. Can you tell us about the NJSNA and your role as CEO?
Absolutely. So the New Jersey State Nurses Association is the professional organization for registered nurses in New Jersey. And we've been around for over 100 years. So we're really the expert when it comes to advocacy and protecting the nursing profession. And as my role as CEO, I am out there lobbying for nurses, lobbying for the profession of nursing, and also looking at other healthcare entities and their impact on the profession of nursing. In addition to that, we also do education programs for nurses. We have support programs for nurses, such as our RAMP program, which is Recovering and Monitoring Program for Nurses with Impaired Practice. So we have a variety of programs that we offer out to nurses, but I think our primary and main sole issue is to advocate for nursing and the nursing profession.
That's wonderful. Would you be able to tell us a little bit about what is nurse advocacy and why is it important?
So nurse advocacy is important because we're there to protect the nursing profession. We want every nurse to be able to not only advocate for their patients, which we all learned in nursing school, how to advocate for the care of our patients. We also need to be able to advocate for our profession in general and our own personal professional ethics. So we go out there and we look at primarily policies in different departments, such as the health department, the Board of Nursing, the Board of Medicine, and other disciplines. We also look at the political spectrum. So what are some of the bills that are out there in the legislature? Who are the legislators that are supporting those bills? Are they bills that will help the nursing profession and healthcare in New Jersey, or could they possibly be bills that may have a negative impact on nursing profession and the healthcare in New Jersey? So that's what advocacy is about. It's about taking care of not only your patients, but taking care of your profession in general.
I'm curious, Judy, it happens to be an election year, of course. Does that affect the way that we look at advocacy, or do we see changes in the way that things are happening on our nursing profession side in advocacy during big election years or cycles?
So during election years, it's very interesting because we do have legislators that are running for office. We also have candidates for our governor positions. We also have those that are just starting out in their political career that may be looking to run for a local office. And they come to us and they ask us, what do the nurses in New Jersey need? What do the nurses in my township need? What can I do as a political candidate help the nurses in New Jersey? Very interesting. In that election year, they come to us. When it's a non-election year, often we're the ones that are reaching out to the legislators and saying, okay, we have this issue and we want to propose a bill that might help to enhance the nursing profession or may help to stop something that may be harmful to the nursing profession. So election years are great because everybody comes to us and we can have that wonderful dialogue. In the off years, we're doing a little bit more hard work when it comes to that advocacy.
Yeah, but I mean, such an interesting kind of dynamic that comes up because oftentimes we see nurses in our care settings, in our clinical settings, but really we have nurses out in these conversations with, state representatives, with local government representatives. And that's just fascinating and so interesting that we can see how our practice is both impacted outside of the realm of our care setting, but also how we also impact the things that happen in our legislation. Like it's just an amazing set of ecosystem kind of dynamics. So super cool to hear that. We know that the New Jersey State Nurses Association is the recognized leader of New Jersey nursing legislation, of course, and you are the local available expert on all nursing legislation here within the state, especially as CEO. Could you tell us a bit about New Jersey nursing legislation that was successful due to nurse advocacy?
So I'll tell you about a couple of legislations that we were able, through our advocacy, working with the legislature and of course with the governor's office and all, is to get some of these bills passed. We were very, very active in. One of them is the ability of the registered nurse to pronounce a patient's death in all different settings. And it allowed also the registered nurse to sign a small portion of the death certificate regarding that pronouncement. Now, that was really to help not only the profession of nursing to elevate that further, but also to help with the families, so that they didn't have to wait for someone to come in to pronounce death. It could be done by the registered nurse. So that was a very successful piece of legislation that we were able to get passed. Another one was the Alternative to Discipline Act. Before this act was passed, a nurse who had an impaired practice, meaning someone who may have diverted medications from the Pyxis machine or, the narcotic lockup drawers in some of the extended care facilities, or a nurse who may have had some sort of mental health issue, which impacted her practice, her ability to practice nursing in a setting. That person could possibly be put in jail, especially when it comes to narcotics. I've seen personally in my practice over the years, I've seen several nurses who were arrested right in the middle of the nurses' station and brought into the local jail. This Alternative to Discipline Act that was passed in 2006 developed a program where those nurses to go into a monitoring program with a psychological screening and then a 5-year monitoring program to help them with their impairment, whether it was through addiction, a narcotic addiction, alcoholism, or possibly a mental health issue. And this really stopped nurses from being put into jail. So that was a very, very successful program that we were able to get passed. The last one, and probably the most recent one, was in 2019 when we helped get passed the Nurse Licensure Compact bill, or what our nurses affectionately call the Multi-State Compact. And this allows a nurse who is a registered professional nurse or a licensed practical nurse in the state of New Jersey to actually join a compact with 26 other states so that that nurse did not have to apply for a license in another state should they choose to travel. For instance, I am a nurse in New Jersey, but I'd like to go down to Florida for a couple of months a year, but I don't want to not have an income. And I would have to go down to Florida. I would have to apply for a license. I'd have to wait for that. With this new legislation and this new bill, I could go to Florida and just start working. Just show them my multi-state license and start working as soon as they need me. So this also was a great, great bill that was passed and signed by the governor in 2019. So those are some of the examples of what we do as far as legislation, advocacy, and making sure that, our profession is protected and enhanced as best we can.
That's phenomenal. And what a boon to our nurses to be able to travel and continue working in their profession. Would you be able to just share a little bit for somebody who's never been, actively lobbying or advocating, what is it that nurses like yourself do to advocate? Are they showing up in courtrooms? Are they writing documents? Are they making videos? What does that look like?
So there's a variety of things that nurses can do. So let's just start with the average nurse who works in a clinical setting, taking care of patients. I'm often asked, well, what can I do? So the first thing you do is read. Go online, pick up a magazine, read a book, and learn a little bit about healthcare and the impact of nursing on healthcare. That's number one. So be informed. Number two, know who your legislator is. Know what voting district that you live in. Get a little bit acquainted with your state legislator. Who is your assembly person? Who is your state senator? What do they stand for? What have they voted on? And they can find all that information out on the New Jersey Legislative website. Now, the next level would be to get really politically involved. Certainly, as a member of the New Jersey State Nurses Association, we have several committees that you can become a member of. One of them is our legislative committee, which goes through all the bills that are in the current legislature that impact, again, not only the nurse, but the profession of nursing and possibly the health care of patients in New Jersey. The third level would be to actually go out and lobby, which is pretty much what I do as the CEO. And I also have a professional lobbying firm that helps me in that lobbying efforts. And that we do go out and we speak to the legislators. We talk about the bills that we want to either oppose or support, and find out information about that legislator and what their feelings are about that bill. In addition, we can go to the hearings in the legislature. So, for instance, for us, we would be going to the health committees in either the Assembly or in the Senate, and we can sit there and just listen to the testimony on different bills, or we could actually speak to those bills. And we've been in many Assembly and Senate hearings where we have spoke about our bills, either the support of a bill that we proposed, or probably the opposition of a bill that maybe another group did propose that may impact us negatively. So again, we can start as just being informed to the point of actually going down to Trenton, sitting in a hearing, and testifying for a bill.
That's amazing. Thank you so much for sharing the journey, because there's so much more outside of our own little clinical care settings that we are able to do to advocate for our profession. And would you mind sharing with us a little bit about some of the current New Jersey legislation that impacts nurses?
So one of the biggest bills we're looking at that really affects all our nurses is the Nurse Title Protection Bill. I don't believe that nurses know that anyone can call themselves a nurse in New Jersey. The actual word nurse is not protected. We protect registered nurse title, we protect licensed practical nurse title, and advanced practice nurse title, and their initials are an LPN and APN. However, we don't protect the term nurse. And I did not realize this until I had a phone call from a nurse in South Jersey who asked me the question, can anybody be called a nurse? And I'm thinking, of course not. You have to go to nursing school, you have to pass the boards, and then you become a nurse. You get licensed by the Board of Nursing. So I did a little bit of research. I looked at the nursing statutes and the rules and regulations, and I was a little confused because I really didn't see the word nurse being protected. So I also spoke to the legal department within the Board of Nursing, and they agreed there was nothing in the rules and regulations that protected the title nurse. So I said, well, we need to change that. And basically what they said was, you're going to have to go to the legislature. You need a bill that will protect the title nurse. So that's what we did. We went down to the legislature. We got a senator to sponsor the bill, and Assemblywoman Munoz, who is a nurse, sponsored the bill in the Assembly side. So we've been working for a few years on trying to get this legislation passed through the legislature. And it is a difficult journey. It does take a few years before we can get some things passed through. Since this is not a life safety issue, it's just a protection of title, it does not become a priority in a lot of the legislative sessions. So we're still working on this bill. We need to protect the nurse because we don't want anybody to come up and say to a person who may be hiring, for instance, A baby nurse. There are advertisements for baby nurses. Not all of them are licensed nurses. They're just lay people who are able to use the term nurse that may feel that they are capable of taking care of babies, and sometimes the public is not aware of the fact and do not ask the question, are you a licensed nurse in the state of New Jersey? So it's not only the nurses that we're protecting, but it's also the public that we're protecting with this legislation. Another bill that we're looking at is our advanced practice nurses. We know that there is a dearth of primary health care providers in New Jersey. Some of our counties are really, really suffering for lack of primary care and psychiatric care in New Jersey. So our advanced practice nurses are certainly qualified to do that. They've been doing that for many, 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 many years, decades, in fact. But the caveat to that is that they have to have what's called a collaborating agreement or a joint protocol with the physician. And that's similar to what we call a contract. And that sometimes causes a barrier for our advanced practice nurses to be able to practice to the full extent of their licensure. So we do have a bill to remove that collaborating agreement. It does not, and I will repeat this again, it does not increase the scope of practice of an advanced practice nurse. All it does is remove that barrier for our advanced practice nurses to actually help our communities when it comes to primary and psychiatric care. So those are our two hot bills that we're focusing on in this legislative session. And of course, other bills that may come up that may have to do with other entities or other healthcare issues when it comes to our citizens. For instance, smoking in casinos. That's a healthcare issue. So we as nurses, although we're not actively out there lobbying for this bill, we certainly support this bill in trying to keep the public safe and also our casino workers healthy. You know, we know that smoking is not a healthy option for anyone, and we certainly don't want those people who don't smoke to be able to be harmed by secondhand smoke. So we're out there supporting those type of bills also.
So you gave us a little bit of an overview, Judy, before about how a nurse would be able to get involved and be a part of the advocacy and the movement. If somebody wanted to get more specifically involved, who could they reach out to, or where would they start looking to understand some of these committees that you're talking about?
So they can certainly reach out to me at the New Jersey State Nurses Association, and I have a very simple email. It's Judy, Judy, at NJSNA.org, and we can talk a little bit about advocacy, nursing advocacy, and really how much you as a nurse want to get involved, because we know that you're working really hard. You know, it's a tough healthcare environment, it's a tough nursing environment, whether you work in a hospital or you work in long-term care or you're a home health care nurse. And also if you're an educator or advanced practice nurse, you know, if you want to get involved in advocacy, we need to have that dialogue to find out how much time, how much energy do you want to be putting into this advocacy role. We are certainly open to anyone who, member or non-member, who wants to have that dialogue about nursing advocacy. We are the ones, New Jersey State Nurses Association, that really go out and advocate for all nurses, but certainly we advocate for whether you are a member or you're not a member. We want you as a member, but we certainly are going to advocate for you as a nurse.
Wonderful. And let's say there was a nurse listening who really would love a career in being that bridge, in being the advocate between the bedside and the practice, you know, out into the world. What kind of, for example, career paths or recommendations would you have in terms of getting experience or maybe going back to school? Like what kinds of experiences are helpful for somebody who really wants to pursue advocacy?
So I think you're 100% right in the fact that going back for some educational opportunities is a great start. Certainly, there are programs out there that offer degrees in healthcare policy. I know that when I went back looking for a doctoral program, I didn't want a clinical doctoral program or a program that looked at nursing administration. I wanted one in policy, and I was fortunate enough to find one that the focus was entirely on healthcare policy. So that was great for me. So I think you go out there, you look at education programs that focus on healthcare policy. And then maybe you look at just perusing the internet. Go on the New Jersey Legislative website. There is hundreds of opportunities on that website, you know, to contact legislators, to speak to policy experts within the legislative arena. Also, go out and talk to your local politicians. Call up the mayor. Speak to the mayor in your township, or talk to the councilman in your township, and learn a little bit more about politics and policy. And then, of course, we're there also to help you if you are interested in policies and politics. There are nurses out there that would like to run for office. We'd absolutely love nurses to run for office at not only the local and state level, but also at the federal level, because we need nurses. There are not many nurses that sit in our legislature. In New Jersey, we have one. In the U.S. Congress, we have 3. And if you look at the number of nurses, there's over 200,000 nurses in New Jersey, and only 1 nurse is sitting in our legislature. So we need more nurses to really think about running for office.
What a great call to action. And out of curiosity, would you mind sharing a little bit about how we as a New Jersey State Nursing Association also kind of play into the dynamics of the larger country? Because you have been saying that we have our New Jersey State Nursing Association, and at a federal level, we also see nurses who are running for office and who are, being involved. Do we do a lot of that from our New Jersey State Nurses Association perspective as well?
So yes, we do. We are an affiliate of the American Nurses Association. So the American Nurses Association is lobbying for federal legislation, and they're also looking at candidates for federal offices, such as our senators, our Congress, and of course also our president. So we do affiliate with them. We do once a year go down to Washington, D.C., and we do what we call Hill Day. So all the states get together. There's probably between 40 and 50 states that will go down to Washington, and we will take a trip over to the Capitol building. We have a set agenda. So what is the hot topics? As I talked about the hot topics in New Jersey, what are the hot topics on the federal level? And then we go visit our elected Congress people and senators, and we talk about those hot topics and ask them to support those bills that we are supporting at the federal level. So we do get involved in our national politics. We take the lead from the American Nurses Association. Although we do have dialogue, so if there's something that they're supporting that we may not be too supportive, we do have that dialogue to be able to say, we don't support that particular legislation. So it's open dialogue, and again, we get that opportunity at least once a year to go down to Washington and meet with our federal legislators.
What an opportunity for camaraderie and for professional networking and for support. What an amazing conversation that must be. And to round out our conversation for today, Judy, we know that leading the charge in advocacy and legislation is a long journey. And you've shared already that it can take months and months and years to move the needle in some of these really impactful legislation pieces. So it's different from working at the bedside, where you might have a shift and then go home and get some time to decompress before your next shift, because some of this work is carry on day to day, month to month, year to year. We'd love to know, Judy, how do you take care of yourself?
So that's a very good question, because it is a year-round 365 days, sometimes the weekends also, when you're out there advocating and you're visiting different other groups that may want to partner with you to advocate. So you do have to take the time. So that is with family and friends, get-togethers for dinner, maybe just a little wine and cheese on the weekend. I do like to golf. So that's also another activity that I like to do. And I also get involved in the Healthy Nurse Initiative. We do have a Healthy Nurse program here in New Jersey that's very successful, great networking opportunities for anybody interested in health. But I also work with the American Nurses Association on the national Healthy Nurse level. So it's get enough sleep, get enough hydration, very, very important to drink a lot of water, and watch my diet, which I try. But exercise is real important. And some days you just need to turn the telephone off and turn the internet off and just sit in a recliner and read a book that has nothing to do with politics or advocacy.
Wonderful, Judy. Thank you so much for sharing with us. We really appreciate having your insight, your expertise, and your wisdom shared today, and hope to speak with you again soon.
Thank you, Stephanie. Have a great day.
You too.
Thanks for listening, everyone. We'll see you next time on the Nursing Insights podcast.
This podcast is brought to you by the New Jersey Collaborating Center for Nursing and the Rutgers School of Communication and Information.